So looking at another aspect of infections that people could actually have, when they are inside the mother's uterus, or you could say pregnant women could have when they have conceived a baby. This is what is known as the intrauterine infections. And under the uterine infections, intrauterine infections, there could be the acute ones, there could be the chronic ones. We are taking this time to actually look at the chronic ones. Alright, so the chronic one is mostly inflammation of the chorionic. Alright, the chorion. Okay, the chorion blood vessels. There could be an infection, and this could actually lead to the inflammation of this part of the body. So chronic intrauterine infections is also known as intra-amniotic infections or chorioamnionitis. Okay, so this infection is when a woman is pregnant, and it will have effect on the baby, it will have effect on the mother. All right, so how do they actually occur? So there are several pathways. Ascending bacterial infection. So ascending bacterial infection just simply means there was an infection right here in the vagina, and it was now going up right into meet the baby. Okay, so there are some bacteria there in the vagina. Normally they stay there. Do you understand? But sometimes if the person's immune system is not strong enough again, they cannot go into cause issues. Transplacental transmission. This one, the infection is moving through the placenta to reach the baby. Procedural entry. Let me say they just did some one or two things to check out the baby, or some one or two procedures to check out the baby, and infections could now move from there to actually infect the baby. So risk factors is it could lead to prolonged rupture of membranes. Risk factors like what could actually cause these infections. Okay, we have moved from how they occur to what could possibly cause them. If there's rupture of membranes and they have left it for too long, that amniotic fluid and all of that could actually serve as a very fertile ground for the breeding of microorganisms. Multiple vaginal examinations, maybe the gloves were not sterile enough, could actually send infections there. Bacterial vaginosis or sexually transmitted infections. Smoking or alcohol use during pregnancy. Previous history of chorioamnionitis. Then assisted reproductive technologies. So signs and symptoms is in the mother could cause fever, uterine tenderness, foul smelling vaginal discharge, rapid heart rate. On the baby, could cause their heartbeat to be too fast. Okay, decreased movement. So potential complications for the baby. The baby might now want to be giving birth to before time because they are no longer enjoying the uterus. Okay, neonatal sepsis and pneumonia, meningitis, brain or lung damage. For the mother, postpartum infections, sepsis, placenta abruption. There's increased risk of cesarean delivery. Management and prevention is most of these infections are caused by bacteria. So you want to give antibiotics to basically stop them. Alright, early delivery, preventive care like regular prenatal visits. Okay, treating vaginal infections ASAP. Alright, avoiding any unnecessary vaginal examination. Alright, because this could actually lead to putting infections right there in that delicate place. So that's it for chronic intrauterine infections.